Hello, everyone, and thank you for joining us in this webinar on an introduction to anxiety. My name is Erin Kapanicus, and I'm joined by Alex Holt. We are two of the school psychologists at the Manitoba First Nations Education Resource Center, or MFNERC. And in addition to introducing anxiety, Alex and I will also be going through some strategies that can be used to support students who are experiencing anxiety or anxious feelings in our schools. So this is the outline of the presentation for today. I'm going to start by providing an overview of anxiety, and then Alex is going to cover fight, flight, freeze responses and what is considered helpful versus unhelpful anxiety. And then we're both going to cover some strategies to support anxious feelings, which will take up the majority of this presentation time. And then lastly, we will provide you with some useful resources that you can take a look at. So anxiety is an emotion that's felt in our bodies, and it often creates a physical response stemming from apprehension or fear of a perceived threat. And that threat can be either a real threat or an imagined threat. And the response we feel is our body's natural alarm system. So it's automatic and it's built in and tells us we need to protect ourselves from some sort of danger or threat. And almost everyone has or will experience anxiety or anxious feelings at some point in our lives. So there's many different types of anxiety disorders that exist. But they all differ in the types of objects or situations that create the anxiety we feel, and in the content of the thoughts or beliefs associated with that anxiety. And this is also known as cognitive ideations. There's, like I said, several anxiety disorders, not all of which you'll encounter in the school setting or even see in childhood. And these anxiety disorders here are essentially based on and ordered according to developmental age. So, for example, separation anxiety, you might see more in younger children, whereas panic disorder, you might see likely in teenagers. So if you want more information on a specific anxiety disorder, please feel free to connect by email. Alex and I will have our emails up at the end of the presentation, and please feel free to reach out if you would like more information. So it's very important that the assessment and diagnostic process is as comprehensive as possible. So meaning as much information is gathered that we can to get to know the child and their situation to better distinguish between disorders, both among anxiety disorders and other mental health disorders, and to rule out any alternative explanations for those anxious feelings. So many symptoms could overlap, and we may adjust the treatment depending on the root cause of the anxiety. Again, this means proper assessment is critical. And the assessment process may look different depending on the presenting needs of the child. So school psychologists, if they're available, they can diagnose, depending on their level of competencies, of course, with this particular diagnosis. MATC or other treatment centers likely have psychiatrists and psychologists that can diagnose, and general practitioners as well. And as psychologists and psychiatrists, we all follow the same diagnostic criteria, which is outlined in the Diagnostic and Statistical Manual of Mental Disorders, and we're in the 5th edition, so it's also referred to as the DSM-5.
So my name is Alex Holt, and I'm going to talk a little bit about what anxiety can look and feel like. So as Erin mentioned, we all have a natural alarm system in our body. So the fight, flight, freeze response is very related to anxiety, as it's an automatic built-in body response that we all have when we encounter some kind of threat. So this can be a real threat. On the left-hand side, we have a tiger. That's a real threatening experience that puts us in danger. And on the right-hand side, we have schoolwork. So that might be more of what is a perceived threat. So for that individual, that stimuli is threatening. So this is a survival response that keeps us safe in times of danger. So if that tiger is coming up to me and my brain is able to quickly perceive that's a threat to my safety, then my body is going to respond in one of three ways. So it might try and fight that threat. It might try and flight, so flee, basically running away from the threat, or we may freeze. So that's kind of when our body and our brain basically go numb and we're just frozen in time. So this is good. This keeps us safe when it needs to, but it becomes a bit of an issue when we're triggered into that fight, flight, freeze mode in response to a perceived threat or nothing that is threatening. So this often happens when we are anxious. So I have a short video that comes from Anxiety Canada, and it explains the fight, flight, freeze response and how it relates to anxiety. This is a great resource you can use with either your own children or the students you're working with, and it's great content and user-friendly language. So we're just going to start the clip.
You know that scared or nervous feeling you get when you have to do something you're not sure you can do? Or go somewhere you've never been before? That feeling is called anxiety. And it can feel a bit different for each person, but it usually doesn't feel very nice. Maybe your palms get sweaty, or your body tenses up, or maybe you get a tummy ache. Maybe you've heard of anxiety, or maybe you haven't, but you've definitely felt it before. Because everyone feels it sometimes. It's normal. You want to know something really weird about anxiety? It's actually trying to help you. It's true. All those uncomfortable feelings, those happen because your brain thinks you're in danger and it wants to protect you. When our muscles tense up and we sweat, it gets us ready to do a lot of exercise, which is helpful if you need to jump out of the way of a runaway train or wrestle a wolverine. Sometimes our minds go blank and we feel like we can't move or talk. That would be great if we needed to hide. Instead, we just feel stuck. When your brain does this, it's called fight, flight, or freeze. The problem is, sometimes your brain gets confused and it can't tell the difference between a charging moose and, say, going to a new school. Both things can be scary and cause anxiety. But there aren't any dangerous wild animals at a new school, hopefully. Understanding where anxiety comes from is the first step in learning to deal with it. So the next time you're in one of those tough situations and you start to feel those feelings, like butterflies in your stomach or sweaty palms, or it gets hard to talk or move, remember, there's nothing wrong with your body. You're just having normal feelings of anxiety, and they're actually trying to help, even if they're not very good at it sometimes.
And so I also just want to point out that there's a link at the bottom to a storybook that's available for free download. It's called Big Feelings Come and Go. And this is another wonderful resource in terms of explaining that fight, flight, freeze response to children. We're going to speak briefly about some of the symptoms of anxiety. So one important thing to remember is that anxiety can look very different for everyone. Generally, it affects us in 4 ways. So our thoughts, our feelings, our behavior, and physical symptoms. So in terms of thoughts, we might see excessive worries or being really apprehensive, having poor concentration and being easily distracted. Feelings, we might see being fearful, anxious, worried, feeling panicky or overwhelmed. In terms of behavior, we might see a lot of avoidance, poor listening skills, seeming distracted, being restless. And then physical symptoms, we might see tense muscles, headaches, and stomach aches. So these are some of the symptoms we are looking for when we're considering something like a diagnosis of anxiety, but then also a lot of this comes up when we're just feeling those anxious feelings. So we're going to move into our section on distinguishing helpful versus unhelpful anxiety. As the video mentioned and Erin mentioned, we all experience some level of anxiety and anxious feelings over the course of life. So this is totally normal. It becomes helpful to consider when anxiety is starting to become a problem for a child or a teenager. So two things we consider are the impact and interference it has with daily living. So in other words, does it stop the child or teen from engaging in their daily life? And then we also consider the distress or impairment that's associated with anxiety. So how much does it stop them and how upsetting is that experience for them? So anxiety and anxious feelings can be thought of as a bit of a spectrum. So it ranges in the number of worries present and the number of symptoms present. So on the left-hand side, when we have less symptoms and worries, we might characterize this as more kind of air quotes normal worry or anxious feelings. So this tends to be temporary, it'll come and go. It doesn't often prevent daily living or not in a very significant way. Typically, the individual can recover from anxious feelings and distress when the events are no longer present. And this anxiety can actually be adaptive and help us make good decisions. So if I'm preparing for a big exam, a little bit of anxiety and a little bit of worry might help motivate me to put in more effort and to prepare for that exam. And so I might actually do a little bit better on it because I had a little bit of worry to keep me motivated. However, we would distinguish this normal worry or anxious feelings from a diagnosed anxiety disorder. So some of the ones Erin mentioned earlier. This would differ in that a diagnosed anxiety disorder is persistent and long-lasting. So we're going to see symptoms most days for months at a time. So it's not following that come and go pattern as much. We're also going to see more interference, and specifically with daily functioning in social, academic, or family areas. So for a child, you might see them doing poorly in school. They may not be able to attend school because of their anxiety, and they might have trouble making and managing friendships. They might not speak at school. We're going to run through an example of this. So this is when anxiety can become a problem. So if we look at the top section, we have functional or normal anxiety. So some situations that cause anxiety for lots of people are going on a first date, having a final exam, giving a presentation, or maybe having first day at a new school. So most of us would agree that it would be pretty normal to bring up some anxiety. So what we might see is someone feels nervous, they feel on edge, they have some nauseous feelings, and maybe they're sweating a bit. So these are some mild anxiety symptoms. Often the result of those symptoms is that the individual, though nervous, will still carry through with that situation. We will also see the individual recover from those anxious feelings shortly after the situation's done. And in some cases, that anxiety may have helped their performance. So if you're on a first date and you're a little nervous, you might actually make a better impression because you're noticing what you're saying and the way you're acting. So sometimes it actually helps. However, anxiety as a problem, we might see the situation being separating from a parent in a familiar environment such as school. So most of us might agree this isn't objectively unsafe. What happens though for the child is the brain misinterprets this situation as being threatening, and we now see them go into that fight, flight, freeze, survival response. So the anxiety symptoms are extreme. We might see refusal, so they don't even come into the school or the classroom, crying, an increased heart rate, lots of tension. So things are a little bit more intense. And often what the result is often the result is that the extreme distress persists. So it doesn't just go away. And the child or the teenager is unable to carry through with the situation because of the anxiety. So either they avoid it altogether or they end up withdrawing in order to cope with their anxiety. So we're going to move into our section on strategies to support students with anxious feelings. I'm going to speak about recognizing anxiety, and then Erin will come back for reframing thoughts and talking about a calming toolkit, and then I'll end with gradual exposure. However, before we jump into the specific strategies, it's important to talk about some considerations or tips when we're teaching these strategies. One important thing to always keep in mind is that coping skills need to be taught, learned, and practiced by children and teens. So managing severe anxiety is not typically intuitive, and it doesn't always come natural to those who struggle with it. So we have to remember that we have to put the time into teaching these skills and giving the children opportunity to practice when they're in a calmer state, so they can develop some mastery with the skills, as well as being consistent. So things aren't going to magically change just because we try a strategy one time. We do have to try it a few times, often before we'll start seeing results. The second consideration is that our goal with all of the strategies is to reduce or manage anxiety levels, as opposed to avoiding anxious feelings forever. So as we've talked about, anxiety can be adaptive, and in some cases it has a place and it actually helps us. So we never want to totally get rid of anxiety. What we want to do is help the child or teen learn how to manage it. The next consideration is that individualization is key. So consider the individual child or teenager you're working with and adapt the strategies based on what they need and what works for them. And then lastly, think about strategies in advance and be prepared. So usually when a child is highly anxious, that's not the time to introduce a new teaching or a new strategy, as opposed to practicing when the child is calm and then having a bank of strategies to draw from that helps you be a little bit more proactive and prepared. So the first strategy I'm going to speak about is recognizing anxiety. Naming and recognizing anxiety, naming and recognizing how anxiety affects a student can help them understand and manage it. So as I mentioned, we all experience different symptoms of anxiety, so it's helpful to understand what are some of the signs the child or teenager can look for in themselves, but then also as the adult, what are some of the signs they're starting to feel anxious and you can intervene with a strategy. So this involves being a bit of a detective and asking the right questions. So if we think back to the symptoms of anxiety, we generally experience thoughts, feelings, behavior, and physical symptoms. So the questions we ask are going to try and tease some of this out. So for example, what do you feel in your body when you're anxious? What comes into your mind when you're anxious? What do you do when you're anxious? So looking at some of that behavior. There are lots of free handouts online if you are looking to help the child or teen recognize anxiety in a more structured way. So this is one I really like from Anxiety Canada again. I find it's more suitable for middle years to high school age students. Basically what it does is it breaks up the thoughts. It provides an outline of the body so the individual can talk about where in their body they feel the anxiety, what are some of the behaviors they do, and then how they feel. So some of the symptoms in a nice bulleted list so they can kind of just check off and talk about what's relevant for them. For younger children, not always, but sometimes they struggle to identify their own thoughts, feelings, and behavior, but they can better able do this with either another person or a character. So Chester the cat is a good exercise to do either with a younger child or someone who's having difficulties identifying those symptoms in themselves. So you can use Chester the cat to name and label symptoms, either that you notice in the child or they notice in themselves. Books and films can be another great way to do this. So if you're watching something on TV, pointing out what the characters may be feeling, asking the child to tell you what they may be thinking about or feeling. We can also do this by modeling what is going through our own brains and what we're feeling. So oh, you could say, I'm feeling really anxious today. I can tell because my stomach's a little nauseous and I have some butterflies in my tummy. And so that's modeling for the child what it might feel like to be anxious. So another part of recognizing anxiety is externalizing the anxiety away from the individual. So this means creating a space between the person and the problem. So giving anxiety a name and a picture of what the child is up against can help them with combating it. So rather than maybe calling it anxiety, you could name the experience the worry monster. So all of that anxious feelings and thoughts can be characterized as the worry monster, and it is now seen as separate from the child or teenager. So the worry monster's job might be to make the child think and feel like something bad is going to happen. So this helps the child or teen see anxiety separate from themselves, and then it creates a space to address the anxiety and challenge of some of the symptoms. Sorry, to challenge some of the symptoms. So the last part of recognizing anxiety is monitoring symptoms. So learning about the pattern of anxiety symptoms can help a child or teen feel more prepared. So if you know what types of situations are going to likely make you anxious and what really happens when you feel anxious, it's less of a surprise when then it does happen. It also allows them then to feel more prepared in accessing an anxiety management tool to cope, potentially before the anxiety gets to such a level that they're unable to do that. This also helps you monitor if there are changes or patterns to your anxiety. So maybe if a child is kind of ongoing monitoring their symptoms, and then they're now using a new tool and they're noticing their anxiety is not as bad, it's kind of nice to have that all recorded and written down so you can understand what strategies are working and what strategies aren't working. So I'm going to turn it back over to Erin now.
Hey, hello again, everyone. So the second strategy that we are going to cover is reframing thoughts, or looking at ways that we can help ourselves reframe some of those anxious thoughts. So before we get into how to reframe our thoughts, let's first quickly look at what is meant by automatic thoughts. So automatic thoughts are very quick thoughts or images that enter our minds automatically and without us even realizing it a lot of the time. And depending on the situation or the environment you are in, an automatic thought can be a good thing or it could be a bad thing, meaning it can very quickly trigger those anxious feelings that don't feel so well. So for example, you're laying in bed one night and you hear a noise in the house. So your automatic thought that produces anxiety might be that someone else is in my house that I don't know about. So automatic thoughts are part of our self-talk. So self-talk is essentially how we talk about the situation causing the anxiety, and that will change how we think and respond to that situation. So we might self-talk that it could be a number of other things that are causing the noises in the house, such as the pets are jumping on and off the furniture, it's windy outside, and it's shaking the shutters on the windows. The house is pretty old and it always makes noises like that. Maybe the furnace just kicked in. And I think for younger students, reassuring themselves and thinking, I know I'm safe because mom and dad are in the next room, or my big brother or sister are in the next room. My pets would probably bark or make other noises if someone was in the house. So this self-talk helps to reassure us, and it makes us feel a little bit more calm in those situations. So our thoughts, our feelings, and our behaviors are all connected, and they influence one another in this kind of cyclical pattern. And cognitive behavior therapy, or CBT, it's a primary treatment for anxiety and anxiety-related thoughts, which essentially is changing our thought patterns and consequently our feelings to influence our behaviors. So in turn, our behaviors or how we react to situations will influence our future thoughts and in similar situations. So keeping that in mind, how we talk to children truly matters. They internalize the language that we use and they say it back to themselves. And this language in turn impacts their thoughts, their feelings, and their behaviors. So anxious children, they spend a lot of time thinking about what can go wrong. And so how they think about an event will greatly influence their feelings and behaviors surrounding that particular event. So some thinking traps. These are thinking traps that we tend to get stuck in sometimes. So thinking traps are certain types or patterns of thoughts that trap us in that anxiety. So the first one is all or nothing. So this means thinking only of possible outcomes at either extreme, either really good or really bad, and then not seeing any of the possible outcomes that are in between or kind of in that gray area. So for example, a student might think, I'm going to either ace this test I have coming up in geography or I'm going to totally bomb it. So they don't think about, I might just do okay on it. And the second one, catastrophizing, kind of a funny word. It means imagining the worst case scenario, no matter how unlikely that scenario is in reality. So for example, a student might get one bad grade on a test and think they'll never get into college or university now. And then the third one, overestimating. So this means exaggerating the likelihood that something bad will happen. So for example, thinking you'll have a heart attack if you have another panic attack. So kind of just thinking the worst is going to happen. And the fourth one is fortune telling. So this means believing you can predict the future. For example, maybe a high school student thinks, I couldn't find a job last summer, so I'm definitely not going to find one this summer. And the fifth one, overgeneralizing. So this means making sweeping judgments about ourselves or about others based on only one or two experiences. So for example, a student misses one goal at their soccer game and they think they'll never score another goal in soccer again. And mind reading, so this means believing you know what others are thinking and assuming it's negative without any real evidence. So for example, a child might be at a birthday party and they think, I know everyone's talking about me, they're talking about how I'm dressed or how weird I look. And then the last one, negative brain filter. This means focusing only on the negative without seeing any of the positive or what is going well. Okay, so beliefs on worrying. So everyone worries from time to time, which is normal, but it's helpful to understand what your beliefs are around worrying and challenge whether those beliefs are actually helping you in that moment. So part of challenging your beliefs is challenging some of the worry myths that are out there. For example, a few worry myths are worrying shows I'm a caring person. It helps me prepare to solve problems. It motivates me. It protects me from feeling bad later, or it prevents bad things from happening. So those are some of the myths that are kind of out there right now. So to try and challenge these myths, ask yourself, what purpose has worrying served me both now and in the past, and has it actually helped me? And can I get the same result in another way? For example, can you be a caring family member in another way besides worrying? Or if worrying helps you feel prepared, are there other ways that are a little more effective that can help you feel prepared? So these are some tools that we're going to cover that can help to reframe those thoughts. So the first one is challenge your negative thinking. So by challenging your thinking, you are paying attention to your thoughts and how realistic they actually are. So this can help to reframe negative thoughts into more positive, realistic ones. For instance, asking yourself, have I encountered this before and how did it go? In 1 month or 1 week or 2 months, how much of this will really matter? And is this something that I can 100% control? And the second tool is telling yourself helpful things. So after challenging and paying attention to your thoughts, write down some helpful statements and say these statements to yourself regularly. So it might seem a little silly at first, but you'll eventually get more comfortable the more times you do it. So these can be more general statements such as, I can handle this, I've done this before, and I can do it again. Or they can be more specific. So I studied very hard for this test, so I know I'm going to do great. Or everyone else is nervous just like I am for this presentation we have coming up in class. So the third tool, let things go. So if you tried tools 1 and 2 and they don't really seem right for you, you can try acknowledging that it is just a thought and let it pass and not give it any power. So picture that thought literally passing by like clouds floating across the sky on a windy day, or like leaves moving down a stream. So you're not avoiding the anxiety, you're acknowledging it still, but you're not, giving it a whole lot of power to control you still. And the fourth tool is becoming comfortable with uncertainty. So by trying new activities that build tolerance for the unknown, this helps you become more comfortable with the unknown or the uncertainty. So for example, you can start small by simply ordering something new at a restaurant. And the worst that can happen is you don't like the food and it's not a big deal. Or if you're a control person, try delegating part of a big project to someone else and just see how that works out. So the idea is to start small with unknown situations and then build up a tolerance for doing activities where we don't always know the outcome. Okay, this is a helpful thinking form that can be found at the link there just at the bottom. So this form is helpful to practice tools 1 and 2 in particular that we just went over. So by writing things down, writing down your anxious situation and feelings, these can be very helpful in making sense and overcoming those anxious feelings. So in this form, you would write down the anxious situation you're in, how you're feeling on a scale of 0 to 10, for example, what anxious thoughts you're having at that moment, and then challenge those anxious thoughts by writing down helpful ones instead. And then again, rating now how you feel on a scale of 0 to 10, or whatever scale you decide to use. Okay, so the third strategy we are going to cover is developing a calming toolkit. So the 4 tools that we're going to cover in this presentation are breathing exercises, going on mental vacations, some tense and release muscle exercises, and engaging in mindfulness activities. So like Alex said earlier, it's important to practice these even when we're not feeling anxious, and finding a quiet place to practice these in, and to utilize when the child is in that in the moment anxious situation. So you and the student can also develop your own calming toolkit with whatever tools or techniques work for that student. So the links at the bottom there, they take you to more detailed descriptions of these particular tools, as well as examples and instructions to follow. So that's there for your reference. Okay, we're going to start with breathing exercises. So the focus of breathing exercises is to engage in slow, deep abdominal breathing that will help to stabilize breathing and help us feel more grounded. So create a calm, soothing place within the classroom for students who are experiencing difficulty in managing their emotions or feeling anxious. So for example, you can have a little space that's blocked off the back of the classroom, or maybe a little calming tent that you can bring out whenever any student feels the need that they need that space. So for other students, this space might be outside of the classroom. So when they're in flight mode, they're very likely to run to that space, and it might be somewhere else in the school. So as long as it's accessible for the student and it's calming for them. So imagery breathing is maybe a little more appropriate for younger kiddos or students. They have the students close their eyes and take a deep breath in as if they're smelling a flower, and then breathe out like they're blowing out a birthday candle, for example. Or smelling the hot soup, where they breathe in and then cool it down by breathing out. Another one is have the student pretend their bellies are like a balloon, so they breathe in and make the balloon bigger, and breathe out and make the balloon shrink. So older students, they may require more age-appropriate techniques. So an example of that is breathing with numbers. So the example here is 4-6-4. You can use whatever works for the student. So they would breathe in for 4 seconds, hold for 6 seconds, and then breathe out for 4 seconds. Star breathing and figure 8 breathing are two other examples that can also be used, and I'll just show you visuals on the next slide. So these are visuals to show what balloon breathing, star breathing, and figure 8 breathing kind of look like. So you can see the balloon breathing there. With star breathing and figure 8 breathing, it can sometimes be helpful or useful to have students physically copying an outline of the star or the figure 8 with a pencil as they follow that breathing pattern. Or other students may only require using gestures and kind of use their finger in the air just to trace that figure 8 pattern or whatever pattern they're using. So deciding beforehand what the student prefers or what works for them is always a good idea. And you may lastly need to model these breathing exercises for the student, both during practice situations and in the moment situations. Okay, the second tool is mental vacations. So mental vacations is a visualization technique which entails having the student close their eyes and imagine themselves in a place that feels safe and relaxing to them. And again, you want a quiet space for this activity. You might use this technique simultaneously with the breathing exercises, or I should say you're very likely to use it with the breathing exercises as long as the breathing is stabilized. So students can make their own scripts as well, depending on the safe place that they identified. But having a script ready is very important, or at least having a place predetermined to imagine. And you as the adult may be required to read the script out loud to the student while they have their eyes closed and they're practicing that breathing. And depending on the student, some may practice this script so often that they might not need somebody to kind of guide them through it, and they might just be able to do it on their own. So kind of differs by student. So you can use, this is an example of a quick kind of general vacation that students can go on. And as you can see, the breathing exercises are an important part of this tool as well. So there's the link there at the bottom. It takes you to this particular PDF script. And at the end as well, there'll also be a link that can take you to all the PDFs. You'll see that towards the end. You can also go on longer, more specific locations mental vacation. So this one here is an example of a beach vacation. And as you can see, it's a little bit more detailed and a little bit longer. So whatever location you and the student decide on, your script should be prepared ahead of time. And again, the link there at the bottom will take you to this particular script. The third tool in the calming toolkit is tense and release muscle exercises. So holding on to stress, it can result in us always physically tensing our muscles. And even when we don't realize we're doing it, this leaves our body and our minds feeling quite drained at the end of the day. So this exercise involves first tensing your muscles in one area or one body part, and then relaxing and focusing on and noticing the difference between tense muscles and relaxed muscles. So for example, maybe you make a tight fist and then you're tensing that fist and then you release, and really noticing the difference between those two feelings in your muscles. So just like the picture there for younger children, it can be a good idea to use maybe one of those stress squeeze balls or a little bean bag that they could squeeze, might be helpful for them. So this exercise leaves the body feeling a little more loose and a little more relaxed. The last thing I will mention is that it's very, very, very important to consider the individual child with this particular exercise and whether this exercise fits or is safe for their physical needs if they have any. So if this exercise isn't safe for the child to do, please consider doing a different type of tool or technique. So this link here at the bottom will take you to some scripts that are useful with younger children. So as you can see, there's some imagery involved in there, squeezing the juice out of a lemon, things like that. So this is helpful for maybe younger children to follow. And then again, the link there at the bottom will take you to this script that is usually better suited for older students. And it's a lot more detailed. It kind of walks through more of the steps that are involved in muscle or progressive muscle relaxation. So just in case they want to do it on their own, the steps in this particular document are quite, they're laid out quite well and fairly easy to follow. So, and the last tool in our calming toolkit is mindfulness activities. So our anxious brains, it tends to focus on the unknown future, and it comes up with all these things that can go wrong and make us feel anxious, or it obsess on past regrets. So the purpose of mindfulness activities is to help us feel grounded and focused on the present moment. So this means paying attention to the present in a purposeful and meaningful way. So some common activities that might come to mind when you hear mindfulness are things like meditation or yoga. And while these are great mindfulness activities for some, chances are that a student who is feeling anxious in the classroom, they're probably not going to start doing yoga poses at that time. So some other things that they can do are a little bit more discreet, and they don't require a coach. I should say they often don't require a coach or an instructor to guide them through it, and it doesn't draw a lot of attention to themselves. So these would be things like doing a quick body scan when we feel anxious. So noticing and saying whatever senses you feel in your body in that moment can kind of bring you back to the present moment. So another one is activating your senses and focusing on your body being present in that moment by naming 5 things you can see in your environment, 4 things you can touch or feel, 3 things you can hear, 2 things you can smell, and if possible, maybe 1 thing you can taste. So These are just some things to kind of bring you back to reality and stop focusing on the past or the future and just help you calm in those situations. So that is the end of the calming toolkit. Again, use what works for you.
Okay, so this is Alex again. I'm going to talk about our last strategy, which is gradual exposure. So when we're talking about gradual exposure, it's really important to talk about avoidance. So I mentioned at the beginning that a result of problematic anxiety can often be children or teens avoiding specific situations. So what we find is that avoidance, when used as a coping tool, often maintains the cycle of anxiety. So if we think of an example, there's an anxiety-provoking situation. For a student, this might be a big test that they have coming up. If this big test brings up all of those anxious feelings and thoughts and behaviors, they may avoid going to school that day so they don't have to write the test. What this does is it gives them an immediate sense of relief because they've gotten out of that anxious situation. However, this is temporary because that anxiety-provoking situation is still there. The test still needs to be written. And so what often happens in the meantime is that your anxiety grows and it gets bigger so that when you next encounter that anxiety-provoking situation, your anxiety is even larger. So your brain has essentially learned that when you avoid a situation, your anxiety goes away. And so it often becomes relied on as a coping tool. But as we can see, it doesn't get rid of the anxiety or reduce it long term. So the goal, instead of avoiding a situation, is learning to cope with anxiety by approaching a situation. So this is where gradual exposure comes in. Exposure means facing our fears in a step-by-step process that is planned, structured, and gradual. So in other words, we're not facing all of our fears at once, but we're doing it in a stepwise manner that allows us to still cope with that situation. So if exposure is done gradually, the student learns that the feared situation is unlikely to occur. So for instance, if they have a big test and they're worried that they're going to get nothing right, well, if they've prepared a little bit, the chances that they will get nothing right are pretty small. So they'll learn that might not happen. They'll also learn that if it does happen, so if they really get nothing right, they'll likely be okay in that situation, even if it's really uncomfortable. So even if it doesn't feel good to do a poor job, they'll still be able to survive that and then move on from it. They will also learn that anxiety is not dangerous, though it is uncomfortable. So even though our heart can be racing when we're anxious and we're facing our fears, we often learn that our heart is not actually going to explode from our chest. So it's not really going to put us in harm's way, even though our brain is telling us that's what's happening. Children also learn and develop a sense of control over the anxiety. So when we manage an anxious situation, it increases the feeling that we can manage it in the future. So practice makes perfect. If you've faced it once, you can face it again, and every time you feel a little bit more in control of that situation. So with gradual exposure, it's really important to be cautious. And I would say the biggest caution is that when exposure is done quickly or suddenly, it's called flooding. So exactly like a real flood, it floods the child. It causes intense fear, discomfort, and it makes it too difficult for the child to cope. So if we think of something like a child who doesn't speak at school, if we force them to go in front of the classroom and offer a presentation to everybody, that's going to be way too much fear and anxiety too quickly. It's likely that they won't be able to cope with that situation, and they're going to be definitely more fearful when they have to go do that again. So even if our eventual goal is that a child who's not speaking might be able to talk in front of the class, that is a long-term goal that we're going to get to when we do lots of supports and lots of step-by-step. So we want to avoid jumping and flooding children in situations they cannot cope with. So rather than flooding, what we want to do is build up the difficulty or level of fear over time and keep this at a level that the child can successfully cope. So this is using small increments. We use something called a fear ladder to plan this out. So what we might do is you might start with easy goals that get harder as we move up the ladder. So what a fear ladder is a step-by-step plan to reach an overall goal with our easier goals near the beginning. So the goals where we don't have as much fear and as much anxiety, and the level of fear and anxiety increases as we move up to harder goals and steps at the top of the fear ladder. So what's important when you're considering developing a fear ladder is we would always do this as a team. So this might include school staff, parents, clinicians, the child or the teenager. Everyone has a unique and important perspective on working with a child. If we all work together on something, it typically helps establish a more well-rounded plan as opposed to just one individual coming up with all of the steps. So this is where it's really important to collaborate with one another. So if we are going to build a fear ladder, we first want to identify what the ultimate fear or goal is. So if the ultimate goal is that we want that child to be able to speak in front of the classroom, that would kind of be what we're working towards. We would then break that goal down into small steps. So the steps are essentially exposure tasks that work towards that final goal. It's also important to note that the steps are always considered safe and low risk. So at no point do we actually want to put that child or teen in any kind of danger. So there are activities that while they might induce some anxiety, they're not actually going to be dangerous for the student. We would also include activities that the student can do with low anxiety. This helps build their confidence as they move up that fear ladder. So once we've done kind of steps 1 and 2, then we would be building the fear ladder. On the side of the screen, you'll notice the thermometer. So this ranges from 0 to 10, 0 being calm and chill, and 10 being most scared ever, I'm terrified. So as we go up the thermometer, our fear gets higher. This is a great way of taking some of those small steps you've created and mapping out where they're going to go on the fear ladder. So an example is if our ultimate goal is that a child would like to be able to approach a dog without excessive fear. We might start way at the bottom, and we might start with looking at pictures of dogs. So that's a pretty safe, low risk activity. We might watch videos of friendly dogs, then watch the dogs outside while we're safe inside. Then pushing it a little bit further, standing outside with that dog, but the dog is 8 feet away. Maybe our next step is the dog gets a little bit closer, then being able to stand beside the dog but not needing to touch it. Then maybe the next step is actually being able to touch some kind of dog, and maybe a puppy is a little less threatening than a big dog. So being able to pet a puppy while someone else is holding it, moving on to holding that puppy, and then being able to actually touch an adult dog that is on a leash, as well as maybe being able to pet an adult dog that's off leash. And so even by doing this fear ladder, we're not necessarily saying that the child always has to be able to pet adult dogs off leash, but being able to conquer that fear will help them in that ultimate goal of being able to approach a dog without excessive fear, because they now have the confidence and the experience to back them up that they've been able to pet a dog who's off leash and been able to manage that situation with support. And so the last thing we're going to talk about before we wrap up is self-compassion. So when you or a child or teen are managing anxiety, compassion is needed above all else. So learning to be more accepting and compassionate with ourselves is a very important step in coping with anxiety. So like I said at the beginning, none of this is intuitive. We don't always just know how to manage anxiety, and we're really just doing the best we can. So it's important to be kind, patient, and gentle with yourself as you are learning to manage anxiety or supporting someone who's managing it. So start by noticing how you talk to or treat yourself as a first step in practicing self-compassion. What you can also do is develop compassionate phrases about yourself and then use this in your self-talk. So basically just say them to yourself. So the 2 yellow bubbles would be examples of compassionate phrases. For example, I'm doing the best I can. I am learning and growing. So it's always a good reminder to say this to yourself, as well as to say to the children and teenagers we are working with. So Erin mentioned kids internalize the language that we use with them. So it's really important that we are using those compassionate phrases so that can become the language they use with themselves. The red bubbles are examples of things you can do to help manage some of that anxiety, being gentle with ourselves. So taking a hot bath, enjoying a favorite movie or food. Okay, so these are some resources that we would recommend if you're looking to learn more information or wanting some different handouts that we talked about. So the first one that we've mentioned several times is the Anxiety Canada website. It is very thorough and very reputable, so I recommend checking it out if you have a chance. The link with the free downloadable PDFs includes all of the different handouts that we talked about in this presentation, so definitely take a look at that if you would want to find those. The Child Mind Institute is another wonderful, reputable website that has lots of information on anxiety and other childhood disorders. Coping Skills for Kids has some great downloadables for different activities and building your calming toolkit. And lastly, the Anxiety Disorders Association of Manitoba, otherwise known as ADAM, is a great resource to check out. We also have some recommended apps for phones and tablets. So some of these have activities like mental vacations and breathing exercises that you can use with kids, as well as with yourself if you're looking for strategies. So there's Calm, Mindful Powers, Smiling Mind, and My Life are all really great apps to check out that are either free or low cost in the App Store, as well as some books. So Wilma Jean, The Worry Machine is really good for elementary age children and talks a little bit about the worries she experiences. And then the Anxiety Workbook for Teens is activities to help you deal with anxiety and worry. So it's more of a self-guided activity book that you can do with a middle or high school age student. Okay, so we just want to say thank you so much for joining us in our webinar on anxiety. If you have any questions, feedback, or you want more information about something, please feel free to email myself and Erin. Our email addresses are on the screen. Otherwise, we will wish you a good day and thank you again.
Thanks, everyone.